Thousands of police calls every year in Spokane and Spokane County are for people having a mental health crisis.
Historically, a large number of those people have ended up in jail. A special unit has been working on keeping those people out of jail, tackling their issues with compassion and alternatives. Is it working, or is it too soft on crime? Robin Nance has this special report.
So right now, I'm going to a disorderly call at North Division in East Indiana. Male running into the street, taking his shirt off, throwing things at passing cars. They believe he's tweaking. It could be drugs. It could be mental health.
This is exactly the kind of call Spokane Senior Police Officer Richie Plunkett is here for.
Every situation's so different.
He spends a lot of his time in places like this, looking for people in crisis and following up with those he's helped before. Most officers don't have time for this kind of follow-up, but Officer Plunkett is a member of the Behavioral Health Unit, or BHU. It's made up of Spokane and Spokane Valley police officers, county deputies, and mental health counselors from Frontier Behavioral Health. Sometimes those counselors ride along with the officer or deputy.
It's nice to be able to bounce stuff off them.
He and his team work closely with the local shelters, homeless advocates, substance abuse treatment facilities, and hospitals.
The biggest issue we're dealing with is co-occurring disorders. So most of the time, the co-occurring is a substance use disorder with some sort of mental health disorder.
Whereas our patrol officers and deputies in the field are often in Band-Aid mode.
Sergeant Jason Hartman oversees the BHU for the police department. He says being homeless or mentally ill is not a crime and shouldn't be treated like it.
Our goal is to basically long-term to provide people that are struggling with mental illness with services, treatment, put them in contact so they can get treatment. And also oftentimes get them up to the hospital if they're suicidal or can't care for themselves.
But there are times when those in crisis knowingly commit crimes and need to be held accountable, especially when domestic violence is involved, other violent crimes, or serious property damage.
There's no trespassing signs all over here, and then you get charged, and I don't want you to get charged. You look fairly young. I've never seen you down here.
Last year, the BHU made contact with 4,912 people. 79% of those contacts ended in something other than sending someone to the hospital or here to the county jail. And of those cases where someone was detained, the unit didn't use more force than just handcuffing.
Are you looking to get into some sort of services?
The unit is paid for through a Washington state grant. And SPD tells me it's a model for other crisis units across the country.
When we start interweaving services, whether it's public safety, nonprofits, hospitals, it works out a lot better. It's a more effective system because without having these connections, we're just going to continue to have a broken system.
Senior Officer Plunkett believes keeping a cool head, using logic, and collaborating are among the keys to mending a broken system. It served him well as a skilled crisis negotiator who teaches it at Police Academy and across the state, and as a man who has a master's degree in social work.
To be able to have law enforcement that's compassionate, empathetic, and willing to work with people. And the more we do this, the more we're able to help more people. Okay, well, if I see you again, I will keep offering, all right?
I'm Robin Nance, 4 News Now, Spokane.